Hey everyone, it's Mary Ann from the New York City Organization of Public Service Retirees. There seems to be a lot of confusion about these new benefits that the United Federation of Teachers keeps adding to their repertoire of union welfare fund benefits. And they're marketed as something that it's as a benefit, but is it really a benefit and is it a benefit to everyone? They're marketed as a concierge service to help walk you through all sorts of stages of need of healthcare and your doctor appointment and your diagnosis. But I want you to hear exactly what this is, specifically from both Hospital for Special Surgery and Memorial Sloan Kettering. And the other point is that they are only available to you if the hospital is in the network of the healthcare plan that you are in. And this became a point that was highlighted, especially in the Memorial Sloan Kettering issue, where they had sent out a letter to everyone in New York City, that employees and retirees, that was on the GHI plan with Anthem as their hospitalization coverage, because they are currently in a battle with Anthem over a contract, which expires on December 31st. That said, if the contract doesn't get renegotiated and is not renewed, Memorial Sloan Kettering would not be in the network for Anthem, which means your union welfare fund concierge service wouldn't be either, because you're no longer in network. And chances are you're not going to be going to Memorial Sloan Kettering if they're not covered by your insurance company, because cancer care is extremely expensive, which means you would end up having to pay for it out of pocket, which most likely you're not going to want to do, nor will you be able to do. So this is why this is important, because in the Hospital for Special Surgery area, you already know about MSK. You already know that under the Aetna Medicare Advantage plan that Michael Mulgrew and Henry Garrido, some of the unions in the Municipal Labor Committee, the City of New York, were trying to force all of us on, retirees and employees. If you eventually got into that Medicare Advantage plan and Memorial Sloan Kettering is not in the network, or Hospital for Special Surgery is not in the network, meaning those contracts don't renew, you don't have access to those facilities. You do if you want to pay up front and submit that bill to the insurer and hope to get reimbursed, but you have to be able to pay for that. And the hospital may not even take you on as a patient in that situation, because your ability to pay may impede their ability to care for you. So knowing, like, I go for my monthly treatment, that's almost $100,000 a month. I'm not going to be able to pay that and then get reimbursed. It's just not going to happen. And you won't be able to do that either. So the Hospital for Special Surgery, so you are aware, under the Aetna Medicare Advantage plan, before we get into the phone calls, Hospital for Special Surgery signed a contract for 3 years, like Memorial Sloan Kettering did, for 3 years only. Then the hospital is in network, but you would have to ask each individual doctor in the Hospital for Special Surgery if they would accept the plan as a network doctor, or would they accept it for payment. If they chose not to, guess what? You're in the same situation. And your union welfare fund concierge plan does diddly squat. So do you really need hand-holding? Have you always been able to make your call appointments and get your visits? This, to me, is not a benefit. It should have been the monies that the unions had should have been put to something with more meat, with more care to it. For someone to hold your hand to make a call or tell you where you should go next, you don't really need that. The hospital already has a special service for it. You call the hospital. You talk to your doctor's office. There's social services there. This concierge doesn't really do anything. So I want you to hear exactly this situation from HSS and MSK, since there are some people within the United Federation of Teachers who are loyal to Michael Mulgrew who don't believe that this is true. It's literally a hotline to help guide you through the process. I don't need anyone to hold my hand. And you guys are educators. You shouldn't need anyone to do that either. So let's listen.
Thank you for calling an HSS Care Concierge for the UFT Welfare Fund. If this is a medical emergency, please hang up and dial 911. For UFT, this is our leadership team. How can I help you?
Yes, I'm interested in finding out more about this program.
What exactly do you want to find out?
Well, what exactly it does is if I'm reading this site, it's you basically help us coordinate making appointments at hospital for special surgery.
That's correct.
And is there anything else other than just assisting us with our appointments, or is there, if you could explain?
No, it's just assisting on appointments.
Just assisting with making appointments.
Right.
Okay, so so that's what I thought it says, but they keep saying it's so much more, but I'm not seeing why I would need this.
It's up to your preference. I mean, we just help with scheduling appointments. If you're having trouble finding a doctor, we just narrow down to doctors, and I mean, the end result is just scheduling you an appointment.
Okay. Because that's what it says. That's part of what it says. It says the concierge team to help guide you, the concierge team to help guide you through diagnosis and treatment options.
So, just in case, because of the way it's worded, if you call in to ask about any type of treatment options, we don't give any type of clinical information. At the end point, it's just us helping you find a doctor to schedule an appointment.
Okay. Dedicated. That's the second point. It says dedicated hotline and email address for contacting your care team. I guess you're the team.
Right. Yeah, because for any clinical information, because the way they worded it, it kind of sounded like you can call in for any type of treatment options, but we don't give any clinical information.
Okay. Assistance with scheduling appointments and coordinating visits. That's what I thought it really was. And then
Yeah.
it says 24/7 access to online tools and education about musculoskeletal health.
That's probably just our hospital website.
Okay. Then it says healthcare coverage. Most hospital for special surgery sites and physicians located in the tri-state area are in network with health plans offered by the City of New York, such as GHI, CBP, and HIP HMO. For questions about whether your specific health plan's in network, please contact your health plan. Which is funny that they wrote that because we'd been fighting them over the union over forcing us into an Aetna Medicare Advantage plan, which thank God we've been winning. But we had learned from your hospital that the hospital would be in network with Aetna Medicare Advantage, but we'd have to ask each doctor if they would accept it.
Right. So, for ATEP specifically, for the Aetna Medicare Advantage plan, we actually don't accept Medicare Advantage plans as a whole. So when patients call in for that, only if if they have added network benefits, that's what we have to ask the doctors if they accept it. But if you're looking for a facility as a whole who takes it 100%, unfortunately, we do not.
I get it. All right. Well, that sounds good. Thank you for clarifying. At least I was able to read through some of the union's propaganda and realize that you're a call service to help us make these appointments solely. So I appreciate your help and your time. You have a wonderful weekend.
Oh, thank you so much. I hope you as well. I hope you do as well.
Okay, bye-bye.
Bye bye. Thank you for calling to schedule your first appointment with MSK Direct. This call may be monitored and or recorded for quality assurance or training purposes. How may I help you?
Yes, hi. I'm calling about this UFT MSK program.
I'm sorry, you kind of cut out. What kind of program?
The UFT MSK Direct program.
Yeah, sure.
So I'm reading the union's website and it kind of just looks like you help me make appointments. Is there other benefits to that, or is it just a call line to help me make appointments?
Pretty much, we are patient intake. So, if you have you or your loved one has a diagnosis or a specific diagnosis, we call us, we take your information, your demographics, your clinical history, collect your records or any materials and get you set up with a statement.
Okay, so because some of this looks kind of like union fluff to me, like it's not really what you do, it's more what our doctor does. So some of the bullet points, it says a dedicated care advisor gathers all our medical records and schedules a timely coordinated appointment with an MSK doctor who specializes in the type of cancer you have.
That's correct. I'm considered a care advisor.
Okay, so you would get all my records and get them to a doctor and schedule me an appointment.
Right.
Okay, so you would have to then ask me for like who my current doctors are to get all my records to send them to your hospital.
Correct. Uh-huh.
Okay.
Right. And then like a clinical history, like let's do diagnosis, that kind of thing. And just records like that's fine.
So you're talking a little fast, so hold on a second. So you just ask me questions, or you actually get my medical records from my current providers?
So both ask questions about the current conditions, what led to it, and then I'm keeping getting your record.
Okay, great. And then it says navigational support from an oncology certified nurse to answer questions throughout my cancer journey.
So we do have nurses here who, if you have questions that I'm unable to answer, you can reach out.
Okay.
And we can probably be more specific.
Gotcha. That might be the last point because it says MSK provides you with personalized screening recommendations and advice how to reduce your risk for cancer through a digital assessment and educational resource. No, that's not it. What does that mean? The last sentence says, access the MSK Direct Cancer Screening Tool, a short, no-cost assessment to receive. It's not even human. It's a tool.
It sounds like maybe an app or a link.
An app. That's what it looks like. Just
few questions and then guide you that way. That's what I'm thinking.
so generally, your service basically helps me make appointments. Generally.
Correct. The initial appointment. Mm-hmm.
Okay. And then after that initial appointment, does your service provide anything else for me? Not really.
Necessarily, but I do have an established connection.
Absolutely. Okay. Thank you so much for clarifying this. I think the United Federation of Teachers should go into advertising because they made this more of than what it really is. It's a call hotline to help me make my first appointment. Oh, thank you so much. You have a great weekend.
You as well. Thank you.
All right. Bye-bye.
Bye-bye.
So there you have it, folks. MSK and HSS are only call concierge services to help you make an appointment. As you just heard the MSK said, it is strictly to help you make your first appointment. And then you already have a provider with their care team telling you what you need. Michael Mulgrew is selling you something that you really don't need. You can make your own first appointment. Your doctor who's telling you, hey, Marianne, it appears you have a cancer. Let's get you set up for your first appointment. They will help you do that. You don't need the United Federation of Teachers helping you contract whatever spending your dues money on a benefit that's touted as more than what it really is. I just read all of those bullet points from MSK Direct and the HSS program to both of those hotlines. And their care members specifically said, we basically just help you make your first appointment. That's really all it is. They'll answer your questions, but that's what they're supposed to do anyway. The purpose of this dedicated line is, I don't know, making Michael Mulgrew seem like he's more important than he really is. This is really nothing than a call center. So I'm not understanding why some of you are making this out to be more than just a hotline. I think your dues could be better spent towards beefing up some of your other benefits that are really more important to you than a call line to help you make an initial appointment. That's just my opinion. Have a great day. So there you have it, folks. You've heard from two different hospitals. Both say the same thing, that both of these services is a concierge service to help you make your appointment with their facilities. They don't coordinate benefits with your union. Your union, if they offer you something additional or special, that's up to them. But they help you make that appointment with their specific facility. It is a hotline to make an appointment. That's all it does. If the union offers you something different, and many of our unions do, many of your unions do, that would be a different story. Now, Ms. Ellie Engler from the United Federation of Teachers, I guess she's some special assistant to Michael Mulgrew, seems to think that because I'm not in her club or her union or her retirees or a retired teacher in her book that I don't know what I'm talking about. Well, let's see. That would be tantamount to saying that a teacher who doesn't have children doesn't know how to teach or be empathetic to children. We're not going to go down that road, are we, Ellie? There's something more important, Ellie. Even if I wasn't an expert in something or I wasn't in your club, what makes the retirees, the New York City Organization of Public Service Retirees, so powerful is that we harness the strength of others that maybe we don't have. That's something the UFT doesn't do. I have 250,000 members, and they're from every agency, every city agency, every union in the city. And I just pick up the phone and I ask them, and they tell me if I'm right. They teach me if I don't know what I need to know, and they help answer the question. I could debunk anything that anyone says to us in real time. So no, Ellie, you're absolutely factually wrong on this. I'm not a retired teacher, but I do teach and I do help people learn. And I work with people in schools. I have worked in the schools before. I used to work in my mother's school and helped them, my mother and the children, even back since the 90s. So I'm going to tell you something. Don't ever diminish someone's power because they're not in your club. That's not cool, ma'am. But looking you up, I don't see you're a retired teacher. I don't see that you're an active or retired member of the United Federation of Teachers, maybe just employed by them. But that doesn't make you in the club either. But it also doesn't diminish what you may or may not know. So take that for what it's worth. Still, at the end of the day, the MSK and HSS program is a hotline to help you make appointments. And you just heard two facilities tell you that in their own words. Now, you can come back and say, well, they didn't know what they're talking about. They were wrong. Well, okay, then maybe you should do a better job of teaching them how to do a better rollout, unless this is what we're to expect with rollouts whenever the UFT is involved, is poor rollouts and misinformation. But hey, what do I know? I've just been fighting misinformation coming out of the United Federation of Teachers for the last 3 years. Anyway, it's Friday. Have a great day, everyone.